Live. Hi, good evening, friends. I'm Dr. Mahesh Naya once again back with another interesting topic, that is eyelid surgeries. And why I said eyelid surgeries, because it is simple to give it a title, but otherwise it means basically periorbital rejuvenation, or rejuvenation around the eyelids and the eye area. Basically, see, eyes are some of the most expressive units. Not units, sorry, eyes are the most expressive parts of your face, and um, so done. Thank you. Yeah. So sorry for the interruption, guys. Today, in fact, I had to start the reel a little late because of some technical glitch. But I'm here and I'm back. So eyes are the most expressive organs, I can say, of your face, and they, along with the eyebrows and the periorbital tissue, they express a lot. So you may look young, you may look fresh, you may look tired, you may look old, all with just the eyes and the tissues around them. So, how do we as cosmetic plastic surgeons help you to get that look? That is what I need to discuss over here. So, obviously, you must have heard of under eye fillers, and what I can say, a little Botox at the crow's feet, or micro Botox to the under eyes to get rid of these wrinkles, basically the tiny ones over there. So, micro Botox, Botox fillers, these are all coming under the non-surgical domain. Okay, so that is not what I'm here to discuss about. As a cosmetic plastic surgeon running Nip and Tuck Aesthetics in Panampedi Nagar, in the heart of Cochin, I would like to mainly touch upon where my expertise lies, that is the surgical prowess. So, coming to the surgeries in and around the eyelid, now many of you must have noticed that, as we age, or sometimes even in younger individuals, we get these upper eyelids which start sagging, or there's excess skin in this particular region, in the upper eyelid or the lower eyelid region. In fact, there are many youngsters these days who are coming with under eye bags because of fatigue of watching screens for a long time, the IT guys and all. So those lead to these under eye bags, and a tired, haggard look to the eyes. So how do we rejuvenate them surgically? That is what I'm here to discuss. Also, many of you have got deflated, or what I can say, hollowed out eyes, hollow eyes kind of, which look like raccoon eyes basically. And why that happens is because anytime when there's a depression basically on the face, light does not reflect back from there. Like, for example, if you notice my forehead, light falls, it reflects, and it can be seen better. But if you notice, these areas, these are shadow areas, so they don't reflect light and they look like depressions. Similar thing happens with your tear troughs. So one of the primary attempts is to get the tear trough slightly up, matching with your cheeks, so that light reflects and reflects from them, and it looks as a unit, which is an extension of the cheek, and it looks like healthy, rather than like old and haggard. So that is one thing that we do, wherein we can bring this unit up surgically, as well as the skin over there needs to be healthy. Like, you must have noticed many a times, the skin over here, which is very thin, is of a different texture and color tone sometimes than the skin of your cheek. Many individuals have that issue, so then we need to seek our dermatologist colleagues' help to get rid of maybe that hyperpigmentation, or some people have those tiny melia like nodules over there. All those kind of issues need to be tackled at a dermatology level. So once that is done, then definitely the surgical aspect can also be taken care of, or whichever is your choice, vice versa also can be done. So one of the modalities that we use to rejuvenate the tissues around the eyes is fat grafting, which is very, very effective. It may be done in one or more sessions. Generally, 2 sessions or 3 sessions are more than enough, so that fat with a long lasting result stays with you, giving you that rejuvenated look. So where all we inject fat is over here in the under eye region, and over here in the infrabrow, what we call. Sometimes some people have very hollowed out eyes, their eyes look like they're floating in the socket. So those all things can definitely be corrected, and you can look age appropriate. I'm not saying that you're going to look 20, 30 years down the your timeline, but at least something like 5 to 10 years off can be taken off from your face, basically, by making it more youthful and energetic looking. So one is that facial fat grafting. I'll again touch upon that a little later, how exactly we do it and in which cases we do it. So coming to eyelid surgeries, here the first and foremost is the upper eyelid blepharoplasty. What we do in that, we take out a strip of skin which is excess in the upper eyelid, and along with that, sometimes the bulging eye pads over here can also be taken out. Now here there lies the difference between an Asian blepharoplasty, where we create the lid crease, and the normal blepharoplasty, wherein we may just take out excess skin and excess fat. Because Asian blepharoplasty is one step ahead of the normal blepharoplasty, wherein we have to artificially even create a, a sulcus or a crease of the upper eyelid. So that is a different topic in itself altogether. Someday I will have an Insta live or a YouTube live on that. Coming to only the blepharoplasty part right now. So upper eyelid can be tackled through a nick right at the crease level, so that the scar or the incision lies exactly in that line and nothing is visible. Of course, the eyelid skin is the thinnest skin in the body, so definitely it generally 99% times it heals well. There is no keloid, there's no gaping, there's nothing of that sort. It heals really, really well. And you may have a little swelling over there for like say 2 or 3 days or maybe a week max to max, but it comes down. And the results are really, really apparent. I mean, on my Instagram and several other this thing, you may find a lot of before afters and all. So the results are really good and they are long lasting. I wouldn't say the results of a blepharoplasty are permanent or something. They may last you 8, 10 years or something like that. But aging advances. I can't reverse aging. I can only reverse. I can only rejuvenate you momentarily. You know, your aging is going to continue. So will the eyelid growth, and you know, you will again have saggy skin. So that is inevitable. So upper eyelid blepharoplasty, then we do lower eyelid blepharoplasty. Now lower eyelid has two approaches. One is with a thin incision over here, a very slim incision just underneath the eye fold, which again gets concealed really well because you've got wrinkles over here. Not wrinkles exactly, creases, body creases. They're natural creases where the body folds. So one is over there, and the second is from inside the eye. That is the conjunctiva, the this region basically. So you can go in from there and take out this fat bag. So many people have these fat bags over here, which are kind of unsightly because they look separate from the rest of the cheek, and you know, they make you look old, haggard, kind of. It doesn't really look youthful. So those fat bags can be taken out. And why do we take this external or this outer approach? Is because sometimes we can even take out loose skin or extra skin can be taken off. So sometimes there is a lot of extra skin over here that can be taken off. These wrinkles can be made to disappear. Sometimes some individuals, I recently did a case of that sort, has they have xanthelasmas. Okay, what that means is basically fat deposits in and around the eyes. It need not be related to high cholesterol levels, but occasionally, I mean, generally speaking, they are found to have some kind of a correlation. But that does not mean that just because your cholesterol levels are high, you're going to get those. So those are called xanthelasmas, which can also be removed with a blepharoplasty approach or something like that. And very much it is correctable. But yeah, mind you, they do come back. There's a bright chance of them coming back as well. So that's a different topic again. Sorry for deviating, but yeah, lower eyelid blepharoplasty, that's about it. You can go in from inside or from outside, take out a little bit of skin, and you know, get rid of that fat. Now, coming to the more advanced concept in this, that is the augmentation blepharoplasty, which we normally do nowadays. In that, we don't not only do the blepharoplasty what I just described, but we go one step ahead by either using the fat which is herniating or pouching outwards to be used as a flap to make this region more youthful, or we add facial fat. We add a facial fat grafting to the blepharoplasty. That is, we take some fat, maybe about 10 grams, 15 grams from your tummy or your thighs, the fat which really lives long, the lower tummy fat, and it is made into micro fat, and that gets injected over here in a very linear manner in small aliquots, such that it does not give a lumpy, bumpy, or sausage kind of an effect, but it settles down really well and makes this area smooth. So instead of creating hollow eyes with a conventional blepharoplasty, what we do is we add a little bit of fat to make them look younger. Fat definitely brings more of a youthful look to the face than I'm not saying get chubby, but what I'm saying is it adds a luster to the face. A face which is devoid of fat, you must have seen a lot of those who go to the gym and they work out excessively and then lose a lot of fat from the face. I mean, that's genetic. You can't have a control from where exactly in your body fat is going to go from. That is genetically predetermined. So some people have a tendency to lose fat from, say, the tummy or the thighs or maybe the underarms, or some people have a tendency to lose fat from their face directly, where the body fat remains and the face goes off first. So those are really unfortunate circumstances wherein your facial fat disappears and then you look like it all looks like sunken in, shriveled kind of look. That is the look where we need to that is what we need to reverse. We need to add fat so that you look younger. So that's about augmentation blepharoplasty, or blepharoplasty with fat grafting added to it. Of course, you can add fillers also, no doubt, but fat survives longer. Longer, the longevity is very long. Hence, we prefer, as cosmetic plastic surgeons, we prefer fat grafting. Okay, and what else? Yes, sometimes these the under eye skin needs rejuvenation in the form of a CO2 laser or an erbium laser, or maybe a chemical peel along with it. So our dermatology colleagues help us with that, and that also contributes a lot to the facial rejuvenation, I would say. Of course, when you come to the periorbital region that I just described with these three, four types of surgeries, you also have something called canthoplasty or canthopexy, wherein your what I can say, the outer end of your eyes, sometimes it sags or it droops kind of. So that is also fixed. Okay, that is elevated and fixed, so that we of course we can even create those cat eyes, but then cat eye surgery is not really something that I would advocate as a cosmetic plastic surgeon to a very large extent, unless somebody really pushes me for it. But it's like you kind of distort the shape of the eyes a little bit, and it does not suit everyone. It may suit certain faces, but it does not definitely suit everyone. So along with canthoplasty or canthopexy, we can even do 2 3 other small procedures in and around the eyes that make them look really good. One is eyebrow. Sometimes we just do the blepharoplasty and then we still wonder why is the person still looking tired. So there the assessment seems to have gone wrong. What we need to first assess is obviate the eyebrow dip. Okay, so we first hold the eyebrows up or in their normal place, and then we see whether there is really an excess of the upper eyelid. Okay, so if we find an excess upper eyelid, even then, that means that the eyebrows are also drooping and you have an excess upper eyelid. So you need a brow lift or a brow pexy along with a blepharoplasty. So the brow lift can be done 2 ways. One is you can go in from here and hold the brow up over here. Internally, what we do. The second is we go in from a small nick over here in the hairline. We go all the way down. Feel your angle. That is the notch. I mean, the region where the eyebrow bends, the arch basically, and that is what we take up so that it looks very young, youthful, and attractive. So males and females have different what I can say, parameters of gauging how we deposit these eyebrows back up. So women need a particular look, males need a particular look. So that is best left to us to decide how we need to give you the eyebrow lift. Of course, we discuss that with you in detail when you come for a consultation as to how your eyebrow looked say about 10 15 years ago and how it looks now and what can we do to lift it up. So eyebrow lift, that is the brow pexy, is there. That's one of the surgeries that can be combined. Or then you even have I mean, the non-surgical part is the Botox. Then over there, like the brow can also be lifted to a little extent by partially paralyzing the upper fibers of orbicularis oculi here, so that the frontalis acts and your brow goes up. So there are numerous ways, or you can even do that with threads. So we insert threads from the hairline down below and lift up this region. But again, that is all temporary. I personally would love to do a brow pexy or a brow lift so that your eyebrows go up in a very controlled manner, and they don't look like Mr. Spock. They should look very aesthetically pleasing. So those are some of the few, the surgical, the technical aspect of a blepharoplasty or an eyelid surgery. Now, coming to the routine consultations, generally, a healthy, fit individual who his diabetes is under control or blood pressure is under control. Why I'm saying that is because generally for blepharoplasty, I get the middle-aged to older populations. I don't get those very young, healthy individuals who don't have any comorbidities. And then they go in for a blepharoplasty. That happens, but very rarely. They may go in for an under eye fat grafting, but need not be exactly blepharoplasty. So the older individuals who come to us, they need to be fit, preferably a non-smoker, because smoking does impair healing and because it obstructs the microvasculature of the skin integument. So definitely smoking is detrimental. Alcohol also, because it promotes bleeding. So these are the few things that we keep in mind before the surgery. The routine blood tests are done. Many a time these surgeries are also done safely under local anesthesia. So either it is local anesthesia or short general. I prefer short general when we go in for four-lid blepharoplasty, that we call both side upper and lower eyelids, along with facial fat grafting. Okay, so that is the time when we prefer a short general anesthesia, so that it is a completely pain-free experience for you. You don't remember or register the bad parts of the surgery, and all you get is a phenomenal result when you get up from your slumber. So we can either perform them under local or general anesthesia. Downtime is really not much. That's another question that I get asked very often. Okay, doctor, can I do this and go back to work? Say 3-4 days down the line. Yes, you can. I would rather say give it about 24 to 48 hours rest, because that is the time when this region may swell up a little bit. So you'll need to give it cold compresses. We give you certain medications, arnica, blah blah. A lot of things are there that I can discuss in detail when you hear for a consult. So there are medications to bring down the swelling, very minimal antibiotic coverage, about 3 to 5 days. Cold compresses help in bringing down the swelling, and that's about it. You may at the max have swelling or bruising. Very rarely, very, very rarely, you may have a small blood clot that also can be taken out, and nothing that will damage or hamper the result or the vision. Don't worry, your eyes are always safe. They are of paramount importance to the whole package, because it is the periorbital tissue that we are rejuvenating. So the eyes have to be taken care of, which we do very, very meticulously. So that's about the prerequisites for the surgery. Of course, it's a daycare surgery. You go home the same day. Usually, these procedures take about 1.5 hour max to max. If it's a full lid blepharoplasty, if it's just the two upper lids, half an hour, and that's it. You're out of the operation theater, and you go home the very same afternoon, same day, and you begin your routine day-to-day existence just the way you were before the surgery. So, of course, we have a certain set of instructions like do not lift up heavy weights, do not stoop down or bend down for long periods of time, do not do steam inhalations. A lot of small things that we advise. It's given usually in a written handout to you, so that you don't forget what is to be done, what is not to be done. So, and generally in about day 5 to 7 days, 5 to 7 days after surgery, I'll need to see you once, so that I can take the sutures out, the stitches basically that we put in the upper eyelid and maybe in the lower eyelid on the outside. So it's just a 5-minute job. You just like pull the thread out, and off the sutures are. You get a scar, not exactly a scar free, but a hidden scar surgery done, no sutures over there. And after that, I would probably see you 1 month down the line to see how it is settling or how it has settled. And by then it's all done. You don't have to worry about any swelling or any complications happening after that, because these are like instantly gratifying surgeries. Eyelid surgeries or periorbital rejuvenations are usually instantly gratifying. They're not like surgeries which you do now and maybe 3 months later you're going to see the actual result, like a rhinoplasty. So it does happen very, very fast. And moreover, these surgeries are usually combined with other facial plastic surgeries that we undertake. Suppose if I have a folded blepharoplasty and the patient wants a rhinoplasty, we can combine them. We can combine it with a brow pexy or your buccal fat removal, dimple creation, maybe lip reduction, chin implant insertion, masseteric Botox, or an otoplasty wherein you take your ears behind. So all these little facial, and we even combine them with a facelift. So in fact, generally they are combined with the facelift, the blepharoplasties, along with the facial fat grafting. So it's a holistic remedy to facial rejuvenation that you seek, including the neck. So everything is tackled in one go. So that can also be done. So that's the versatility that you get with eyelid surgeries, because they can be combined with a lot of other surgeries. So I think that's about it. I've covered. I think I really went too fast, but technically also we have covered a lot about eyelid surgeries, blepharoplasties, and all today. And if there are any questions, please put them in the comment section. I know the most of the comments that come are the downtime and how will I recover, what will happen with the bruising. Bruising, trust me, in 2 weeks time it disappears. uh, Whatever, maybe about 10-20 cases that I've done recently, there has been no bruising also. There's just a swelling, which is the body's reaction that is bound to happen. So if your surgeries are good, bloodless kind of, then definitely we don't get a lot of bleeding. Our anesthetists are fantastic. They give really good anesthesia. The blood pressure is well controlled. So we don't land up with any of the complications usually which occur, which are frequently seen. So the complication rate and all remains really, really low, and your vision remains intact. We rest assured about that. That all is well taken care of. So these are relatively safer surgeries amongst the whole armamentarium of cosmetic surgeries. And definitely I would like to elaborate more on these topics when you come and discuss it with me face to face, regarding this to be combined with something else or vice versa. So thank you all for your patient listening. And I just needed to keep it short. I don't want to make it too long, otherwise the video gets boring. So if you have any questions, put them in the comment section or get in touch with me on the numbers provided over here, and I'll be more than happy to answer all your queries. Thank you so much.